Welcome. This is Dr. Angelo O. Subida. I'm a psychologist, psychotherapist from www.drsubida.com. Today, I'd like to talk to you about depression. Depression is a number one issue that we're having right now all over the world as a result of this unprecedented trauma that we're going through, which is the coronavirus pandemic. I've lost everything. This COVID lockdown, what's the use? Nothing matters anymore, said one of my clients that I'm counseling, that I'm doing therapy with over Skype. There's this emergency room doctor in a well-known hospital in the United States who suffered a lot of anxieties and a lot of depression during her time of treating COVID patients. Eventually, due to the height of her depression, she reached a certain threshold whereby she could not take it anymore and she took her own life. There's this jeepney driver who just tried to hurt himself while he was taking alms, while he was kind of doing something in order to make ends meet, and he was about to also hurt himself due to his mental state, his condition of being so anxious, so overwhelmingly angry and depressed about his economic condition. Depression is really a complicated problem if we are to go by its different dimensions. There are different aspects of it and there are different circumstances, and everyone is unique. So it depends on the circumstances surrounding the person, and it also depends on the mental state, the emotional state, and even the spiritual state of the person responding to a situation of crisis, normally, to a situation of deprivation, to a situation of loss. And what we have right now, this COVID pandemic, is that we, all over the world, are experiencing a lot of heavy losses. And it's not just medical, not just in the area of economic or loss of income or finances, not just restriction in our movement, not just a change in our environment and so on. There are so many losses that are sudden and overwhelming that somehow would lead a lot of people to a point of exhaustion, to a point of no longer able to take it. And so a number of them would suffer this kind of a mental condition. So all over the world, we're not only having a medical pandemic here, but also, more so, a mental health pandemic. The suffering of it, the pain of it, and all the challenges associated with it. I have so many things that I can cover in this discussion about depression, but let me try to do it with the limited time we have. Depression is usually associated with emotional suffering. It's mourning. It's usually connected to affliction, to a thought of gloom, melancholy, illness, heavy destruction, tribulation, injustice, agony, and so on. It's a feeling of sorrow, a feeling of grief. But I think for us to have a handle on whether something that we're going through is really depression, you have to differentiate it from sadness. There's a difference between sadness and depression. Sadness is a normal emotion, and it's something that every one of us, every person, would experience at some point in life. When we suffer a loss, when we get sick, when we lose a job, or we flunk a certain examination, or maybe you lost a loved one, or a boyfriend, or a girlfriend, or a family member, a spouse, and so on. Whenever there is a loss of heaviness, a loss of possessing something, usually there is going to be some level of sadness. However, it's different from depression, because when you say depression, even with such a trivial stimulus, even with such a small trigger, one can feel very, very sad and very, very hopeless, even about everything, not just towards or as a result of that loss or environment or some wound and so on. But a depressed person would feel sad and hopeless about everything. So even if there is food on the table, even if there is a job that he likes or he loves, even if there is a good relationship in the family, or maybe a good career in his life or her life, he would still or she would still be depressed, because he would feel sad and hopeless about everything already. Some people who are going through this pandemic, they would experience not sadness, but a level of depression that would make them dysfunctional on their everyday life. They could not function anymore. So there's a gradient scale. In other words, there is normal depression, there is mild depression, and then there is a midpoint, and beyond the midpoint would be the severe level of depression and the chronic level of depression. The normal, the mild depression, that's something that more likely can be manageable. The person can manage it most of the time by himself or herself. But when the depression has already reached the severe or chronic level, that's the time when the person needs outside intervention. That's the time when the person possibly needs to be hospitalized or would need to seek professional help, because he or she has already reached a certain level where he could no longer take care of himself. So that's depression, and there are causes and symptoms and origins of depression. And as I've said a while ago, it is often caused by losses, often caused by a lack of heaviness. So this pandemic that we're having, it causes a lot of emotional shock in many people. And for some people, there's already a pre-existing mental condition, all the more because of the heavy losses that we're having, the challenges, the sufferings we're having through this pandemic. All the more a person who is vulnerable, already having a pre-existing condition, would experience a higher level, a high grade level of mental condition, such as depression. And when a person is severely depressed or chronically depressed, there is usually a number of symptoms that you need to pay attention to, and you need to be guarding so that the person would not be out of control, so that the person would be able to seek some help, or some people would be able to help him or her. Symptoms like a loss of perspective because a depressed person, the severe and chronically depressed, they are usually not able to perceive reality as it is. Their comprehension, their perception is usually very, very much affected by their emotional and mental state. There's also reluctance to communicate. They're usually careless about their physical health. They are neglectful about their eating habits, their sleeping habits. They have a weakened sense of awareness and responsibility. And a lot of times they would make foolish, costly decisions due to being overwhelmed by emotion. Their everyday affairs, they seem far away and unimportant. Time is unreal for them. Religion, if they have one, is limited to after death, then what? And their self-image is very much limited to poor me. So those are some of the signs, some of the red flags, some of the symptoms that you may want to pay attention to. When you're trying to diagnose yourself or when you're trying to help another person undergoing the chronic and severe level of depression. If depression, especially the high grade one, is not appropriately and sufficiently managed, there will be a lot of deadly consequences. There could be a lot of deadly effects. People who suppressed their grief, people who suppress their legitimate feelings, they risk being chronically neurotic or depressed or even psychotic. The effects could be avoiding social life, and they become hermits, some of them. Some of them break into tears even after years of the death of a loved one. And then they suffer loss, and then they would be getting sick physically as well, because their depression, their mind is already producing physical illness as a result of untreated depression. Then there would be, that's what you call psychosomatic ills. Then there would probably be also some form of phobias and a sense of helplessness, sense of hopelessness, and so on. And the effects on the person may reach a certain level whereby when the person already shoots up, already reaches a certain point of threshold inside him or her, that person may already be self-sabotaging. The person may already be starting to harm himself or herself unintentionally, even outside of awareness most of the time. So what are the methods that can be done? What things can be done to alleviate these symptoms, these effects of depression on a person? Even during this pandemic, we do have a lot of opportunities to be able to help another person going through this. But even if you're the one who is depressed, high grade level depression, I mean, you're experiencing that, there are things that you can do. Something can be done in order to prevent unnecessary suffering and pain. In the world of the Red Cross, they have what they call first aid. And they would usually do first aid as an initial step in order to save a person's life. It's usually on the scene treatment that they would do, and they call it first aid, and that's physical first aid. If you're experiencing a high-grade depression, or you have somebody in your life, somebody that you care for, who is experiencing high-grade depression, you can perform first aid, some form of first aid too. is a mental health first aid. We can call that. And most of the time, you would need to do some work on the area of being able to go alongside the person, because in order to alleviate the symptoms of the depressed person just needs to have somebody to listen to them, to listen to him or her, and for him or her to experience a place of safety, a place of being accepted, a place of being loved, a place of being taken care of, a place whereby he can or she can experience a gradual redemption, a gradual redeeming, a gradual experience of being able to feel some things that need to be filled as a result of some losses that were experienced by him or her. There are external and there are internal things that you need to put in place in order for a depressed person to heal progressively, to recover progressively. External things would be the developmental logistics, the external logistics in the setting up of a therapeutic or healing place for the depressed person. And of course, you need to remedy heaviness, because depression is usually associated with losses. So as much as possible, if there is a chance, if there is an opportunity, if there are resources to restore heaviness to the person, that would contribute a lot to the remedying or to the alleviation of the symptoms of the depressed person. That can be in the form of maybe food, maybe the form of a safe place where he or she can stay, in the form of a unified community, maybe a family get together where he or she can belong. It could be in the form of a healthy passion for something, a healthy hobby, a way of relaxing, or a way of having to spend certain things on what he or she wants, and so on. Now, if you are depressed, don't bug out with booze or drugs. It only adds to your problem. Don't get drunk. Don't take drugs. It could give you a temporary relief, but after that, it actually just adds to your problem. It only makes your situation worse. Okay? So, and nowadays, depressed persons, whenever they get exposed to a lot of social media, news, and so on, they would feel all the more depressed. So there could be a need for some external limitation, some setup whereby there would be some boundary there, there would be some limited supply in this area of being exposed to social media on a daily basis. Then there is this curative component in order to alleviate the symptom of depression. Curative component, and I refer to the internal part, the emotional part, the non-physical part, the non-material part, the emotional part, the mental part, even the spiritual part of the person. And that might entail a lot of help outside if the depression has become high grade. Okay? That might entail a lot of professional help with the use of psychotherapy, counseling, psychocybernetics, with the use of cognitive behavior therapy, even psychodynamic therapy and all these other things, uh, a highly depressed person might be able to reach a certain point where he could be aware enough of where it's coming from, treatment given, and then there would be prevention of relapse in certain areas, and the person would be able to go back and functioning and gather enough inner resources and resilience to be able to resist, to be able to fight the challenges that he or she is having in his or her life. So that's the internal part. That's the curative component. Curative because that's where permanent recovery lies. Even if everything in the environment, even if COVID will not go away, even if there would be more and more and more losses as a result of the pandemic, a person who has enough internal supplies, enough inner security, enough inner confidence, would be able to resist hopelessness, would be able to resist helplessness because of this inner confidence, this inner security. He would have the hope and he would have the creativity and resilience to be able to face any challenges. For you to be able to help someone with depression, firstly, you have to assume a guard position, especially when the kind of depression is chronic or severe. So don't let the high-grade depressed person wander around, or they might do something foolish. Make sure you are assuming a guard position here. Just be there. Never leave a person who is in shock, especially. Never leave a person who tends to hurt himself or herself. Assume a guard position. And then, if there's a need for you to notify the relatives or notify the authorities, then you would have to do that, especially if necessary. And if the depressed person is shedding a lot of tears, then you need to encourage a level of dignified weeping, a level of dignified mourning to help the depressed person express it out, to run it out of his or her system. So don't prevent a depressed person to express it out, to run it out, especially when he or she is weeping about a certain problem. And there could be instances when you need to ward off some well-meaning relatives or friends who will cheer him up, who will cheer her up. Why? Because the depressed person would need to externalize the pain. The depressed person would need to bring it out. So if you prevent the depressed person from working up what's inside him or her, you are preventing the person to heal. You are preventing the person to recover. So make use that you keep the use of alcohol or drugs at least under control. Okay. And in times of real depression, in times of uncontrollable, unmanageable, much deeper levels of depression, prayer and spirituality is usually a very helpful psychological tool. Okay? Prayer offers bits of perspective and calmness and stillness for the depressed person to be able to to make him or her think about life and things uh, as as realistically as possible. A lot of times, when there is prayer and when there is spirituality, it becomes a psychological lifesaver at a time when everything seems hopeless and helpless. So, if needed, if you're the one helping the person with a high grade depression, there could be a need for you to bring him or her to seek professional help, such as with a psychologist or a therapist or a counselor. Because remember, when you talk about depression, just like other mental conditions, we're not talking here only about external or the developmental logistics that need to be put in place. Real, permanent, deep level healing comes from the internal, the curative component. And that can happen only because the person cannot cure himself. That can happen only in the context of professional help, where things can be much more effectively processed for the person. So that's my talk for you today about depression. I hope that helps. Thank you, and take care.